Hi there. Failing to intervene when a child has suffered meconium aspiration syndrome is one of the worst things that a hospital can do. Meconium aspiration syndrome is when a newborn actually has aspirated or swallowed or breathed in meconium while still in the womb. Meconium is the first bowel movement that a baby releases. Typically, meconium comes out after your baby's delivered and at home in a diaper. However, there are times where meconium can get released while still in the womb. The release usually occurs because of some sort of fetal distress. For example, a baby that lacks oxygen can release its meconium still in the womb. Why that is dangerous is because this meconium is essentially feces, and it is now mixing with the amniotic fluid that's in the womb and now starting to go into the baby's mouth. Once in the baby's mouth, the baby is either swallowing or breathing it in. The worst thing that can happen is the baby breathes it in, that meconium, the feces, and it gets into the baby's lungs. Once inside the lungs, it gunks up everything. When the baby is delivered, the obstetrician and the nurses should see that the sac had a meconium stain to it, either a green or a brown kind of stain. It's not going to come out clear. When that occurs, they should be aware that meconium may have been aspirated, may have been swallowed or breathed in by the baby. And therefore, at that point in time, they need to intervene. The typical treatment for intervention for meconium aspiration syndrome is oxygen supplementation. For very severe cases, a newborn will need to be intubated. However, typically there are very mild cases of MAS, meconium aspiration syndrome, and a simple ventilation through a nasal cannula is allowed and required as the standard of care. However, it doesn't stop there. Meconium that has been aspirated needs to be seen and monitored at all times. The breathing of the baby needs to be monitored. One of the things that meconium can do is eradicate or strip down something called surfactant. The surfactant is something that destroys the inside of the lungs, or the meconium destroys the inside of the surfactant lungs. That needs to be addressed as well. If you believe that your child had a meconium release while in the womb and developed meconium aspiration syndrome, and that the hospital didn't do enough after your baby was born, then you need to speak to a birth injury lawyer to know your rights. My name is Adam Funk, and I am a birth injury lawyer, and I would be happy to help you.